Welcome to The Explainer. So India just made this massive, historic bet in its latest health budget. We're talking about pouring a ton of money into training healthcare workers. But here's the critical question we're asking today. Is this a brilliant move that's finally going to fix a broken system? Or are we just training a huge army with nowhere to fight?
So, check this out. For the very first time, the health budget crossed 1 lakh crore rupees. Now, this isn't just some small bump. No way. This is a massive, landmark figure, and it's basically shouting that there's been a major shift in what the country's prioritizing.
And you know, it's really not just about building more hospitals or clinics. The real story here, the thing that's truly different, is a total shift in strategy. It's this move towards what you could call manpower first thinking. The government is basically betting that the future of healthcare is all about the people, the trained professionals, not just shiny new buildings. But that brings us to the big question, right? The investment is huge, for sure. But is the strategy behind it actually complete? I mean, is it really enough to just bet on people if the systems to support them, to actually put them to work, just aren't there? All right, so let's really dive into this. Let's break down what these budget numbers are actually telling us about this new focus on people power.
You know, what's super telling is where the money is actually going. It's not just for doctors and nurses. Get this. The budget is aiming to train a massive 150,000 caregivers in just 1 year. 1 year. Plus another 100,000 allied health professionals. This is a huge investment in the entire ecosystem of care, from top to bottom.
But, and this is a big but, here's the hard truth you find when you start digging a little deeper. See, investing in people is one thing. That's great. But actually connecting them to the system, getting them where they're needed, that's a whole different ballgame. It's like the funding gives us a powerful engine, but what about the tracks for it to run on? Yeah, this quote just nails it, doesn't it? It gets right to the heart of the problem. So what does happen to all these newly skilled people? Well, without a real system to track them, to validate their skills, and to place them in jobs, they just kind of drift. They end up in the informal economy, their skills get wasted, and poof, they basically disappear from any official data. And that's the thing. The budget puts up the money for training, but it doesn't really give us those rails to fix these huge gaps in the system. I mean, think about it. How do you track these trained caregivers? How do you even know their skills are legit? How do you match them to the people who actually need them? And how do you turn all this training into real, formal jobs? These are the big unanswered questions. Okay, so if the system is so broken, how in the world do we fix it? Well, the source material we're looking at proposes a really powerful idea, something that's pretty much become unavoidable in any modern labor market. And that idea is a platform. And look, when we say platform, we're not just talking about another app you download or some simple job website. No, think of it more like an operating system. It's that essential digital layer that's completely missing right now. The infrastructure that could finally connect all the scattered, fragmented pieces of the healthcare labor market. A platform like this would do 5 really crucial things. First, it would keep a live list of everyone's skills. Second, it would validate their certifications so you know they're qualified. Third, it would match the right people to the actual demand from hospitals or families. Fourth, it would track how they're doing. And finally, it would help them build a real career path. The impact here could be absolutely transformative. You'd be creating visibility and efficiency where right now there's just chaos. And maybe most importantly, it could turn care work from what's often seen as a low-wage, dead-end job into a proper, structured, and visible career with a real future. Okay, but let's zoom out for a second, because this whole thing builds towards an even bigger idea. It turns out that by solving this problem at home, India could be perfectly positioned to tackle a massive global need. I mean, the data is pretty stark when you look at it. All around the world, in Europe, North America, the Gulf, populations are getting older. Chronic care needs are skyrocketing. And what that means is they are all facing a severe shortage of skilled caregivers. Simple as that. They have the demand, and India has the potential supply. But see, to actually meet that global demand, there are really only 2 ways to go. There's the current path, which is kind of messy, unstructured, ad hoc. Or there's the platform path, and that way allows for a systematic, quality-assured approach that turns this whole thing into a huge strategic, economic opportunity for everyone. So here's the really crucial point. This isn't just some pie-in-the-sky theory. The source material we've been looking at actually lays out concrete, actionable steps that can be taken, like right now, to start building this future. And this quote just completely reframes the whole conversation. It says that investing in a skilled, organized healthcare workforce isn't just social spending. No, it's economic infrastructure. It's just as critical to the country's growth as building roads, ports, or bridges. It's literally nation building.
And these are the immediate practical building blocks for it. And here's the kicker. None of this actually requires new budget announcements. What it does require is coordination, real intent, and that platform-style thinking. Linking funding directly to job placements and integrating all the digital systems to finally create a cohesive whole.
So at the end of the day, the signal has been sent, the investment has been made, the people are ready to be trained, and the policy intent seems to be there. But the real, true value of this historic budget, that will only be unlocked if the systems, those digital rails we've been talking about, are actually built to connect all that investment to real, measurable impact. And that, right there, is the question that's going to define the next decade of healthcare in India.